great segue into the next question, again, to you, because it's specific, is that what is the most important thing to discuss with my doctor about DLBCL treatment? So apart from toxicities, what would be the one other or two other aspects that patients should be asking you as a lymphoma doctor?
Yeah, so I think that's an interesting question because I think there's the what the doctor wants to talk about and then there's what the patient wants to talk about, right? So as a doctor, you always need to explain, obviously the risks and benefits of treatment. I often find that, usually the first time I meet with a patient and we go over everything, I always tell them you're going to forget 90% of everything I just said, right? So and that's fine, right? So I encourage them to come with somebody. I encourage them to bring a notebook. I encourage them to write down questions. But I think the most important thing is for the patient to really understand the drugs that are being put in their body. And also, I think I must start people on 10 other like oral medications, or I prescribe like 10 medications whenever I start a patient on chemotherapy. And that can be excessively confusing, even if I go over it 3 times, right? So for you as the patient, you really want to understand what are these drugs, what are they for, when do I take them. A lot of patients also they have a lot of questions about diet and exercise. Can I exercise? What can I eat, right? And these are really great questions, and I don't particularly put very stringent limitations on my patients other than like obviously not eating any raw food, raw fish, undercooked meat, anything like that. But every patient is really different. Some people don't have a family. They want to know about support systems. Some people do have a family. They want to know, can they work? Can they be around their young children? What if their child is sick? Should they not be around their child? So really the questions you should ask your doctor are the things that are really important to you, right? Because, I always say the one thing like, I'm not the one that has to take the chemotherapy. You are. So this has to fit into your life. You need to understand the things that are important in your life so you can structure this around, your values and your life.
Absolutely. Thank you for that.